All right, welcome to the episode 6 of the Dreamers podcast. We're bringing on individuals that have transformed their careers and are empowering the future generation. I'm Munir Rahman.
And I'm Asfan Musa. And today's guest is someone who redefines what physical therapy looks like in the modern age. We're honored to welcome Dr. Marvin Jacob, who is a doctor of physical therapy, a content creator, a mentor, and a movement advocate based in Houston, Texas.
He's worked with physicians from pro teams such as Houston Texans, Astros, and the Houston Dynamo, mentored residents at Houston Methodist, PT residents at Houston Methodist, and uses social media to share empowering, evidence-based advice to help people move better and hurt less.
Dr. Marvin Jacob, welcome to the Dreamers podcast.
Thank you, guys. Thanks for having me here. I'm excited.
Oh, thank you for coming on. And I guess we'll go straight into questions.
Yep.
So one main thing I wanted to ask you is, can you take us back to the beginning on how you started? What inspired you to pursue a career in physical therapy, especially in orthopedics and sports medicine?
Yeah, so, movement has always been a part of my life. Growing up as a kid, you play a bunch of sports, you get hurt, and you go to PT, if you're lucky. Sometimes, your parents will say, oh, you don't need to go to PT. You just need to rest it off or throw some dirt on it. I've had a number of injuries in my past, like playing sports. And this is not sports for school or anything like that, more recreational, basketball, football. I did a little bit of boxing as well, just like training and stuff like that, right? With the heavy bag. And you kind of realize that there are certain things. And also, once I got into high school, I really started hitting the gym, working out consistently, strength training and stuff like that. And again, some of these things, they produce injuries, right? So one of the times I dislocated my shoulder on the left, I've sprained my ankles, I've hurt my knees, tore my labrum on the right. So I've had to have PT quite a bit. And so that was kind of my introduction to what physical therapy is. I didn't really know. When you watch physical therapy on something on a TV show or in the movies, you just see somebody walking beside the patient and kind of walking with them. That could be a nurse, that could be an assistant. We don't know what that is. Yeah. But the world of physical therapy, as what I knew it before PT school and then after PT school, is kind of quite different. The more I got into physical therapy and studied the concepts, the musculoskeletal system, the more I realized that the concepts of movement as medicine and the non-surgical conservative approach to dealing with people with injuries or with pain, that's kind of where I kind of grew this love for physical therapy. But I've always been like a nerd for anatomy, a nerd for biology, all that stuff that kind of gets people into the healthcare field, right? You kind of have a knack for that kind of stuff. And so that was also in my school studies. That was one of the things that kind of made me gravitate towards health sciences. And then, when I was coming down to, I have two older sisters. One was a pharmacist, the other was an OBGYN. When the other sister was she was in, I believe, undergrad, and I was kind of trying to figure out where I'm going to go in terms of PT, med school. I was also interested in virology. She was like, hey, you're going to spend a lot of time if you're going to do med school. Right. In your studies, in residency. And if you go into fellowship, there's a lot of time studying. And so she's like, if you're really passionate about PT, you should do PT. And so that's kind of where I went. And I got into physical therapy, and I've never looked back.
No, that's great to hear. And I feel like you mentioning your injuries is kind of one reason you got into it. Was there a certain experience, like a doctor's visit or something that kind of structured your way, kind of how you treat your patients now?
So I've been fortunate to be around a lot of very intelligent, very just skillful physical therapists around the Houston area, and had some treatment from some, had mentorship from others. And I think the patient-centered approach, right? That's something that with PTs we can really be effective with, right? Because we spend an hour with most of our patients, when especially in the outpatient setting. So I do outpatient orthopedics and sports PT. So when I see these patients come in, whether they have an orthopedic issue or a sports issue, I'm able to spend a full hour with them, from the time I evaluate them to the treatment sessions to progress notes to discharges. Every single person is going to come with a set of findings that I get to evaluate and assess during an evaluation. And from there, I can tailor my specific care towards them. And that's exactly what I had when I was a patient. My PTs would say, all right, let's move your shoulders. What are your goals? What do you want to get back to doing? And meeting those people at where they're at, right? Because we all have different health literacy rates or understanding, a different understanding of what injury means, of what pain means, cultural differences as well. of how we approach injury and how we approach pain. So that's something that I kind of was able to shadow with some of the PTs. When I was in my undergrad studies, I was volunteering and shadowing because you have to get a certain amount of hours of shadowing to get into PT school. So you would see that, these different population areas as well, how you talk to these people, how you get on their level. That's really important and helps with the effectiveness of your care.
So having that personal connection is very important for you.
100%. And it doesn't matter what, subset of the healthcare field you're in. You have to approach that patient. And for some professions, for some, medical professions, it's a little bit more difficult because you're constrained on time. We have a full hour, so we get to build rapport with them. We get to, especially when in the cash-based setting where I see one-on-one, I don't have to see 2 to 3 patients like I used to when I was in insurance-based care. So you're able to really develop that relationship with them, and then you get to glean more information from them as well. And you said, "Oh, wait, you also, you're also a hunter, or you also like to do this. You didn't tell me about this during our initial assessment. So let's get you." Get your goals. Let's add that to your set of goals of what we want to get you back to doing.
No, it's nice you say that because we also had a cardiologist who had something similar to say, where he was like, it doesn't matter like how fast you can get done with that and move on to your next appointment. What matters is basically you taking your time with the patient that brings in and like get to connect with them on a personal basis, get to know their life. Yeah. And then because that's how you find out like what's the best way of treatment for that specific patient.
Yeah. And one of the big things in the PT world is switching from insurance-based to cash-based. How can we individualize our care to these people when insurance reimbursements are dropping for physical therapy services? 100%. So then companies and businesses are, PT businesses are requiring us to see more people per hour. How does that, and then, they tell us, no, you can still have the same quality of care. No, you can't. If you're divided between 2 people, 3 people, you cannot keep the same quality or the level of care. As if you were to be one-on-one with somebody, right? So when I first came into practice, we would schedule patients every 30 minutes, 2 patients every 30 minutes. So 9 o'clock, 2 patients, 9:30, 2 patients, and each of those patients would stay an hour. So at one point we would have 4 patients that we would have to treat. Now, as a physical therapist, sometimes you do the manual stuff, like the passive range of motion, some mobilizations, some pain management type techniques. And at the same time, there's another person over there doing their exercise across the gym, and you're trying to manage both of these patients and then multiply that however many people that you have. The quality is going to go down. And so that patient-centered approach, it becomes more of a what we call cookie cutter approach. And that's something that nowadays we're trying to tackle that issue of how do we remove that and or at least reduce that with our populations among clinics.
It's like that, you think
quality over quantity, right?
Quality over quantity, exactly. And it's like, imagine you're going to the dentist and you're sitting in your chair, but there's a person in a chair next to you, and the dentist is like working on you here, and then it's like, give me a sec, let me work on this person over here. You'd be like, what am I doing with my mouth open next to this other person? Like, this makes no sense, right?
That's right.
Just like that, we've kind of become complacent with treating 2 to 3 to 4 patients an hour, and we call those places PT mills. Because all they want to do is just generate the money out of it. And then you see people who come to me afterwards, they're like, I don't think physical therapy works. And I'm like, why is that? Oh, because I went to this one place and like it just didn't help. And so now their whole definition of what rehab is
that bad experience.
Exactly. So that takes them a couple steps back and it makes my job harder to convince them like, no, I will get you to that point. Because I'm going to be different from those guys.
But you must be getting your patients back. They come back to you because you're giving them this type of care.
Of course. And that's one thing that I can be proud to say, that like my patients love what I do and they know that I can connect with them on that level. Even if it's not from the like, all right, let's talk more about your pain. Let's talk about who you are as a person. Because that also gives me an understanding of maybe how I can do some specific exercises that you'll appreciate. Like if you have kids, young kids that you have to pick up off the floor and your back is hurting, how can I help you do that? Instead of let's just work on back bends or let's work on strengthening X, Y, and Z. Let's get you to that specific goal because I know more about your life.
Yeah. And also want to talk about a little bit more about your education and the doctor of physical therapy. Many people don't know about that experience on what it's like. Can you talk about like that experience, and what was the hardest part that you went through, like going through that education?
So, I mean, I started school in 2014, so I feel a little dated here. So the process might be a little bit different, but I went through grade school in the Sugarland, Missouri City area. So that's Southwest Houston for people who are not from Houston. But that's where I went to grade school, and then I went to the University of Houston. And I did my undergrad in kinesiology. So 2014 graduated. 2 weeks later after graduation, started PT school at Texas Tech in Lubbock. And so I was like going from a big city to like a small city, small town. And it was fun though. We had a great time. There's people from Houston, from Dallas, from all around Texas, in that little community. So you kind of have a family that you're with, like these, let's say roughly 50 people that you're with across the 3 years, because the DPT programs are 3 years, graduate programs. Then after graduation, you can select to go into residency, and that's a 1-year residency, whether that's orthopedics, sports, neuro. You could do, I believe oncology is also a specialty that you can get into. Then there's like pelvic health.
Okay.
And then I believe there's a couple other ones. And then beyond that, you can also do a fellowship, which is also a year.
Okay.
So if you, let's say, for instance, after you graduated PT school, you did your 1-year residency in sports. After that, you could do an upper extremity sport fellowship. Okay. Or D1 sport fellowship. Okay. So there's different kind of subspecialties that you can do. Okay. And I can talk a little bit more about one cool thing that we were able to do with our PT residency once we get to that point. But I'm glad you guys kind of bring up that topic too, because most people don't understand that we have a doctorate in our profession. Yeah. And one of the things that I like to highlight as well, and I talk about on my social media, is the title that we use as, Dr. So-and-so, if you call me Dr. Jacob or even when people call me Dr. Marvin, this is not to conflate our degree and our education with the medical profession, right? A medical degree, MD, DO, anything like that, right? But this is to allow us to tell our patients that we have a doctorate level education so that we can help them through their process of pain.
It's that type of trust, because people want to get the best care, right?
Right. And so when they hear, oh, you're a Dr. So-and-so, again, and this is also, I think, dependent on the setting that you're in, right? So if I'm in a hospital setting and I'm going into the patient's room, they're having 20 people walk into their room anyway. So they don't know who's exactly. What. So I'm not going to say, hey, I'm Dr. Jacob, physical therapist. I'm going to say, hey, I'm Marvin. I'm your physical therapist. Let's get you up and walking. Okay. But in the outpatient setting, my front desk, the schedulers, myself, my techs, they're going to say Dr. Jacob or Dr. Marvin, but I'm not going to require that. If my patient wants to walk in and say, what's up, Marvin? Hey, what's up? Yeah. Right. But I want them to know that I have this education, this degree that allows me to be able to treat them for their pain, their low back pain, neck pain, shoulder pain, whatever it is, or post-operatively. And I am at that expert level for their needs.
And I feel like that's one thing is like, even, you were a doctor. PhDs are considered doctors too. Correct. So it's like you went through a education to go to a point where you can treat these patients. Correct. So I think this is 100%, like that's one thing we want to bring you on too, is kind of showcase that part of medicine, because a lot of people don't know about it.
Yeah. And I appreciate that though, because that is one thing that I think is overlooked with our profession. Yeah. Or is not taken as seriously with our profession, but it is something that I think we are very proud of, and we're kind of pushing that needle forward. Yeah.
All right, let's move on to the next segment.
All right, so I want to talk more about your movement-based mindset. I know you have built your practice around the idea of that movement is medicine. Can you explain what that philosophy means to you and how it's different from the quick fix mindset?
So yeah, and I mean we talk about this a lot. The quick fix mindset is, let me just put something on this to alleviate my pain. Let me take some kind of medication to alleviate my pain. Or is there some kind of injectable, whatever it is, topical, that I can just get to, get rid of this pain? Instead of that, we try to look more towards the conservative management and also look more towards movement as it pertains to reducing pain, improving mobility, and also bolstering your body to prevent re-injury, right? So one of the big things is we want to protect the back, protect the neck, protect these specific areas that are painful, and exercise can do that, especially resistance exercise, whether that's weight training, Pilates, bands, whatever calisthenics, where's body weight. Those things can help to not only get you out of pain through what we've seen through the research, but also prevent that from happening as well. Yeah. We can't prevent every kind of injury, even the person with the strongest core, they still might have back pain.
Yeah.
That's what we're starting to see as well. But exercise in itself can help you get out of that pain. And then it can also help to prevent that coming from the future. So that is one of the mindsets that as physical therapists, we push that forward because, again, we don't want somebody to get an MRI of their back and then immediately think because they have a disc injury, right, or some kind of disc herniation, let's just kind of lump it into disc herniation, that they now have to get some kind of discectomy or some kind of surgical intervention versus trying the conservative management, because that is what the research is telling us. And beyond the musculoskeletal system, you also know that, obviously for the cardiorespiratory system, for the cardiovascular system, for the brain, there's so many benefits, abundant benefits of exercise because we're made to move. So that's why movement is medicine.
And I feel like the human body is amazing. If you really think about it, like the human body can achieve so much if you're just putting in the work of just exercise. That's one thing I think we've like started doing a lot more is like exercising, and it really does help a lot.
We used to be the kids like going in just lifting heavy, thinking everything is fine, not listening to our bodies. But recently we've started thinking like, okay, we are getting like a little bit older. We're not there yet. But
wait till you get to my age. Don't even start it with me, guys. Yeah.
So we're taking more precautions, listening to our body, just including like movement-based workouts instead of just like going crazy,
strength training,
and the thing is, it's injury and how we overcome that injury. It's a balance between how much the volume that we're doing, right? Whether it's resistance training, running, whatever it is that we're putting onto our body versus the capacity that our body has. That's why you can see people run marathons because they have that capacity to run marathons. Or you see these power lifters, Olympic lifters lift insanely heavy weights because they have the capacity. But even them, if they go over with the volume, they can get injured as well.
Yeah.
So it's that balance between what is too little versus what is too much. And staying within that window, which is, if I had that knowledge, dude, when I was in high school, if I had a portion of that knowledge, oh my gosh, I was thinking about it too. I was like, man, I'd had so many fewer injuries. I feel like the newer generation too, they can just YouTube this stuff. Like my nephews will talk about, like, he'll just be like, yeah, I know, I learned about this. I learned about the body. And I'm like, dude, you know so much about stuff at his age. He's like 11 years old.
Oh, wow.
At his age, he knows so much about like the human body. Whereas I had no idea what I was like, I think this is like a bicep. I think so. I don't know. At that age, I don't know.
The knowledge is easily accessible.
But it's also difficult too because there are deviations from what is correct information that starts to go into misinformation.
A lot of like TikTok videos, they're talking about things and I'm like, that's not even evidence based. Like, dude, just saying it.
And even people who have the highest credentials, they can also be mistaken in the advice that they're given. So like I'll hear, whether it's a chiropractor or a physician or a physical therapist, they'll say on this thing like, you should never X, Y, and Z. And the amount of people that have come to me and said, hey, my doc said I can never lift something up off the floor. So what happens if you drop something and you need to pick it up off the floor? Because they're that afraid because this person in a white coat told them you should never pick something up off the floor again. Without giving any context.
Exactly. And it's conflicting information. So I think that's one major thing. I think, that's like a big problem right now.
So that's big in, we've seen it, I've seen it in real life, but also, I mean, it is abundant in like the TikTok, Instagram, social media era, right? So.
And you often highlight the non-surgical evidence-based solutions to common issues like sciatica and back pain, herniated discs. Can you walk us through a few of the most common diagnoses you see? And more importantly, for people dealing with something like sciatica, are there any specific exercises or habits that can actually help?
Yeah, so there, when it comes to my field, right, we have a balance of what does the diagnosis say, let's say like an ICD-10 code say versus what are their findings, what are their impairments. So if they come to me with, I don't know, let's say, they had a diagnosis of sciatica or just general low back pain, or they'll have like a sprain of the low back or whatever it is. That is one thing that is on a specific diagnosis based off of a medical code, right? And they probably went to their physician, they had an X-ray done or an MRI done, and this is what they find, right? Now my job is to parse if that diagnosis correlates with their clinical findings. Because again, I have a full hour with these people, and I think the studies show like almost 80% of the population will at some point deal with low back pain. It's as common as a common cold.
Yeah.
So when it comes down to something like, and low back pain by far is like the most that I see.
Common.
So I wouldn't even say like it's like specific like disc herniation or let's say lumbar stenosis or something like that. Let's just lump all that into LBP, low back pain.
Yeah.
Low back pain is for sure the most. And then neck pain, whether that has, it involves headaches. If it doesn't involve headaches or shoulder pain or neurologic symptoms, then you have shoulder pain and then knee pain.
Okay.
So those are like the top 4 that I would probably say. And then again, when it comes down to shoulder pain, is it rotator cuff versus labrum versus something with your joint versus something else or something muscular. So what I have to do in terms of the non-surgical approach, a lot of it is education based, because when somebody comes into my clinic, they're especially with the low back, because people are always afraid, like, I don't want to, throw my back out again.
Yeah.
No, for sure.
I don't want to try to, pick up my daughter and then all of a sudden I can't stand back up. I'm terrified of that. And the people have that anxiety because, again, they've seen older generations of people who have had low back pain from labor-based things or from whatever life situations that gave them low back pain. And now they're just kind of, their backs are shot. They'll talk about how their dad or their grandfather could never straighten up because of that pain. Well, their dad or their grandfather probably didn't go through a structured exercise program to get them back into that. But that's what the benefit of them coming to see me is. So a lot of that is education. So I tell them, typically the natural history of low back pain, 4 to 8 weeks. So sometimes if you will come to me or you don't come to me, most times your back pain actually will get better.
Okay.
But what can I do? I'm not going to just be like, all right, so that's it. No, see you later. No. See you in 4 weeks if it doesn't get better. No, that's not what I do. Sometimes I'll say, all right, let's figure out what's causing your pain, especially if this is acute low back pain. So I figure out what's going on through a full examination. If they have neurologic symptoms, which you're talking about sciatica. So that can be lumbar radiculopathy. So it could be like the numbness, tingling, maybe even weakness down the leg. Or it can be lumbar related radicular pain, which is mostly like that sciatica kind of pain that goes down their leg. Either way, we do a good assessment. We do a good history, figure out what's going on, what provokes their pain through a movement test and through talking to them. And then from there, we're able to do a structured approach. And some of the things that I do, obviously exercise is key, is king. It's a top priority, right? But some of these people are so afraid or they're nervous to even try to do any of these movements. Or if they try to do some of these movements, they're in a lot of pain. So what I do is I use specific techniques like cupping, manual therapy. I'll even do like some types of traction and stretching. Or even something called dry needling is where I use acupuncture needles and I work into getting some of these areas desensitized and bring down that pain threshold. So then they're able to do some of these exercises and then I can show them, hey, look, this is safe. You're not damaging anything. You're not hurting anything. And then from there, we just build off of that foundation. I give them homework to do. Hopefully they do their homework. A lot of times they don't. So you're trying to, kind of chase them down with that as well.
Do you think patients lie to you sometimes?
All the time. Oh my gosh. It's so funny too, because they think that they're like slick with it. So they'll like come in and they'll be like, and I was like, so how are your exercises? Any questions? Oh, no questions. I'm like, and you did them all, right? Like, yeah, I did them all. And I know which exercises they are because it was like a list of maybe like 5 to 6 exercises. And I was like, tell me which ones did you do again? And they'll be like, well, there's that one where you're on your side and you're rolling. And I'm like, I don't know what you're talking about. Or sometimes they'll just be like, yeah, no, I didn't do my exercises. Like, I'll be honest, I was traveling or something like that. And I'm not going to be mad at them because I'm my own worst, patient as well.
You're just trying to help them out.
Life gets busy. Exactly. But you just want to know where they're at. Again, meet them where they're at. But sometimes, I can give them crap for it. It's kind of fun.
And I want to know, so something like a sciatica, is that something that people are stuck with life, or is it for the right approach, it is treatable, you think?
I would say for the most part, yes. Because I don't want somebody to think, okay, I have sciatica and now I'm doomed with this unless I have some kind of decompression surgery, whether it's a discectomy or some kind of laminectomy or something like that, laminotomy, whatever it is. I don't want them to think that is their only, the future going forward. You can, even if you have, let's say, some kind of compression or entrapment on imaging, you can still have resolution of your symptoms. So that's why we always try to do conservative management first before we try to look into something else, like an injection or something like surgery.
Okay.
So you always want to approach that. So even when it comes down to sciatica, there's a lot of different versions of sciatica and how it manifests with people. certain areas that are tighter, certain areas that are more sensitive and painful in terms of the muscles. And then also there's certain areas that are weaker. Because why? Because maybe because of the nerve, but also because of disuse.
Yeah.
So if my right side is really painful, I'm going to probably sit here on my left side more.
Yeah.
This. I'm probably going to stand on my left side more. And that's overall, if I'm working out, if I'm doing squats, I'm going to probably lean more on my left side. So then you might feel some weakness here. So through those findings, I'm able to target exactly what I want that person to do. And then I'm able to watch them, supervise them, and then show them, hey, look how much you've improved, because we'll do retests, but also at the same time, give them homework and say, this is where we have to keep going. So I've had bouts of sciatica myself, doing what we call ego lifting, right?
Yeah.
You see everybody around you lifting heavy. It's like, I can do that.
Yeah.
And you don't listen to that recovery side, right?
Yeah.
That warning in your brain of like, I don't know, this is probably not a good idea. Or you see a cute girl in the gym, you're like, I got to lift super heavy. Let's go. Full send. And I had an issue with sciatica as well. And I remember when I came, I had to drive from Lubbock to Houston. And this is actually exactly after we had learned like the whole nature of in the process and the rehab course of low back pain, especially with dealing with discs. I remember I was like kind of diagnosing myself with movements, and I was like, oh, this might be a disc issue. This might be disc sensitivity. I had to drive 8 hours back to Houston. So sitting in a car for 8 hours. And then I remember, I think it was like somebody in my family that had seen that and told my mom, and my mom was like freaking out. She was like, oh my gosh, you have back pain, and this and that. And I told her, don't worry, it's going to be fine. I'm going to get better.
That's what I'm learning.
Exactly.
I got it.
It's going to be okay. And every once in a while, it might kind of flare up here and there, but it's nothing that's not manageable.
That's amazing.
And I have no worries as to the future management of that as well, especially because I'm in this field and I see this all the time.
Yeah.
So.
And I know you've also talked about how important sleep is in physical therapy.
Yeah.
So why is sleep such a vital part of rehab and overall performance? Could you talk about that?
Yeah. So rehab, performance, recovery, life in general, sleep is so important. Like, and I'm super appreciative of like some of the sleep scientists that are becoming more popular, especially during in like social media and stuff. They're kind of doing podcasts and all that, like Matthew Walker, PhD, but they talk a lot about how these different processes in our bodies are affected by sleep. Obviously, the brain is affected by sleep, right? So if I'm working with an athlete after ACL reconstruction and I'm teaching them how to squat, teaching them how to walk, and then eventually doing running, jumping, cutting, sprinting, their brains need to process that as well. It's almost like learning these movements again or relearning them. So you have to go through the brain mapping and the processing, which a lot of that happens during sleep, right? You make those connections. And then growth hormone. Growth hormone is amplified with good quality sleep, right? So we know that. So if you're trying to heal tissues, you want those natural processes to be occurring during the sleep process, right? And then obviously pro-inflammatory markers are increased when you have less sleep. So that also makes your pain sensitivity higher, right? So you're going to be more sensitized to pain because brain changes, but also inflammatory changes. So I always tell patients, like, especially either if it's post-op or non-operative, get your sleep, be consistent with sleep. And then they've even done studies to where they found that if, basic things, if these people aren't getting basic things like sleep or walking, they can have higher chances of neck pain, low back pain. So I always promote proper sleep, not just proper sleep in terms of like getting 8 hours, but the quality of those 8 hours and the consistency of those 8 hours as well. And then on top of that, getting at least 7K steps a day.
Okay. Well, thank you for saying that. I'm going to show my mom this.
Definitely. Absolutely. Yeah.
All right. So let's move on to the next segment then.
All right. So I kind of want to talk about your social media presence and like what made you want to start creating content and kind of putting like physical therapy out there.
So I've always had a knack of like being able to post things and like record things. Like sometimes when you see somebody on social media, they post a video, whether it's like a medical based or educational based, and you're like, that just didn't hit the mark. Like they just may not understand that side of things, right? Yeah. That's okay. But I feel like I've had a good understanding of that. And then I've also had a good support system of like friends who've also done it. And they're like, dude, you could totally do this. Like if you feel comfortable in front of a camera, which I did, right? Especially after a couple takes and stuff like that. I was like, all right, this is kind of cool. Yeah. And so a couple of my friends, they convinced me like, just start posting and see where it goes. Yeah. And so I did, and it kind of I got to relate with a lot of like PT students, new grad PTs, people who want to get into physical therapy, other people in healthcare, and then obviously like, you know, the general population based off of what I posted. And it's been a good journey ever since starting around the pandemic time.
I feel like people are more appreciative of like doctors putting out content more often now.
Yeah.
So they can relate to it. Like common people can like get to learn from your videos.
Yeah. We just have to be very careful as to what we post. It's like you're given this kind of like power, so you can't just post anything that you want to post. A lot of stuff I post always has like these like caveats or like fine print of like, you know, like if I post dry needling, if I post cupping, I'm always kind of talking about like, hey, this is not the fix. Because again, we don't want to just rely on quick fixes. We want that long-term adherence to a consistent movement pattern or program, right? So that's kind of one of the things that I like to talk about as well in my social media is that like we're given this power to do this. Make sure you do this responsibly.
Yeah, like responsibility, I think is a big thing in this environment, especially when you're a doctor as well. I feel like you don't want to put out conflicting information out there. That's why I think it's good that you're always putting out like a warning or like it's not like, you know.
Yeah, or just say like instead of like saying this is how it is, you can say this from my experience. I've seen this. Yeah, which that'll at least give the person the understanding that it may not be what somebody else thinks, but from his or her approach, this is where they see the effectiveness. Yeah,
and also like a lot of students are it's now the social media age is coming with TikTok and Instagram. Like we're seeing a lot of different types of, I guess, people like that are posting. What advice would you give to students that want to start posting like medical related content or like just content in general in terms of educational?
So I think this goes with any kind of student in healthcare, because your main goal is to become the profession that you're studying to be, right? So if you're in med school, PT school, pharmacy school, whatever it is, focus on your didactics. Yeah, that's number one, first and foremost. If you feel like you have a good handle of that and you can do something on the side where you can post and learn the content creation side of it, then do that as well. You can do that. But you have to be able to have your priorities down, right? Yeah. Because you can't do it all. Yeah. And then learning to post, learning how to set cameras up, set mics up, how to speak in front of the camera, or if you're doing a skit, how to do the voiceover. That all takes time. A lot. So much time to learn, right? You have to do trial and error. I mean, I've gotten to the points where I was doing this on my phone where like my eyes would hurt. Because I would do this, I would see patients for an entire caseload of patients. Then I would do my social media posting, and like it's like nighttime. I have these artificial lights going in my eyes. Dude, my eyes had bags under because there's just so much light, and I was like getting that blurry vision. Yeah, the blue light. You're just doing so much work on your phone and devices. So I guess my advice would be number one, focus on didactics. If you feel like you can have a grasp on some of this social media stuff, play around with it. See what areas are that you're strong in. If you like to do the voiceovers, do that. If you have a good voice for the mic, then talk to the mic and you can talk and do that. Yeah. If fitness is your big thing, you can post about fitness as well. Yeah. If you have good camera angles or this or that. And then I guess the other thing would be like, from what I've seen, at least in my experience, is if you have some level of manageable consistency, that's the best way to go. So, and you know, you'll see some advice gurus or social media gurus, they talk about you have to post like 3 times a day. Yeah. What? That is insane. Yeah. I remember when I first heard that, I was like, bro, what? I guess I have to quit my job. Like, how are you supposed to do that with the full caseload or like 40, at least 40 hours of working? And then if you're going to like in residency where you're like 60 hours or something like that, right? Of work.
It's not even possible.
Yeah. So it's like, how would you be able to do that? And then if you're going to try to look at least somewhat presentable and instead of your hair all over your face at the end of the day, so you have to kind of balance that whole thing out. But if you can have, like I said, manageable consistency, once a week, do it.
No, that's great advice.
You can do that, right?
Nice.
I think let's move on to the next segment.
Yeah. I want to talk about, so you have worked alongside some of great athletes of different levels, middle schoolers, high schoolers, college students. What have those experiences taught you about resilience and performance?
It's taught me a lot about, again, meeting these people where they're at and making sure that, especially with athletes, you keep that sport going along the rehab process. So if I have a basketball player, then I'm going to tell them how this is going to help. This exercise after their ACL surgery is going to help this player get back to their sport. If we're doing specific drills, I'm going to put a basketball in their hands, and let's say we're doing side steps or something like that, and I'm kind of giving them a distractor by bouncing a basketball into their hand. They have to bounce it back to me. I'm keeping that ball in their hand. I'm telling them, go to your practices. Keep making sure that they're continuing the sport, whether it's during the rehab or outside of that. But it's also taught me that, like, just like the general population, sometimes staying on an exercise program is not as easy as we think it is.
Yeah.
It's also taught me that athletes are good at hiding their pain.
Yeah.
Or what they're going through psychologically.
Yeah.
Because after an injury, a lot of times they see these, career ending, or like after their injury, these players don't come back to their sport.
Yeah.
So you can see psychologically it takes a toll on them. So there is that almost responsibility as a healthcare provider that I have to continue that resiliency with them, or help bolster some of that resiliency within them, and remind them this is the goal. We're going to stay on that goal and stay on that track to get them back to their sport. Doesn't matter what level it is, because a lot of them, once you get to know them, and I have an hour with them every session, they tell me some of the things that go on in their head. And I don't have a psychology background, right? Yeah. So I do have to figure out ways that I can kind of talk them through, whether it's connecting with a sports psychologist or somebody who's trained in CBT, and be able to address those areas that need to be improved as well.
That's amazing advice. I love it. And is there a case or a patient story that stuck with you over the years? Something that reminded you why you do what you do?
Yeah. This is actually kind of recent. I had a patient who he stopped exercising. He was kind of bedridden for a little bit, but he stopped exercising. He said he was an avid athlete. He would run. He would work out all the time. And he got to the point where he was just so afraid of everything. Because he had stopped working out, and he had heard from specific doctors or specific posts that he would read, like, oh, if you have this kind of back pain, you need to have this done. And so he lived in like a fear-based approach. And when he came into my clinic, he's like, I don't think this is going to work. And I was like, that's great. I'm glad that this is how we're starting off on it, So I was like, all right. But I mean, dude, it got to the point where he was afraid to go up and down stairs because he thought that was going to affect his back. But I taught him one step at a time. We got him to go up and down stairs. He was afraid that push-ups were going to affect his shoulders or hurt his rotator cuff. Again, I had to teach him and show him that he had the strength within himself. It wasn't that he like, obviously he was quite a bit weaker because he stopped all movement and stuff, and he was stiff, but he was also very afraid. And so that was something that it wasn't just the easy, like, all right, this is the exercises we're going to do, and you're going to do it. You're going to get stronger, and you're going to be like, oh, wow, I don't have that much pain anymore. This was a lot of like encouraging, reassuring, and it kind of reminded me, and his example may be a little extreme, but that these people aren't just coming to you as muscles, joints, tendons, ligaments. They're coming to you as a full human, and you have to address that entire human.
No, and I feel like if you lose confidence in your body, it's such a horrible experience because you can't do a lot. Like if you think about it, it's like a lot of just daily activity just become like foreign to you. So
it's foreign, and then you don't want to do more, and then you want to do less.
Yeah.
And that can lead to more kind of seclusion. You don't want to hang out with people.
Yeah.
You don't want to because then these people are going on walks, or if they're going to play bowling or something like that.
Yeah.
Then you don't want to go hang out with them, or pickleball, let's say, whatever it is. So then you're not as social, and that can lead to depression and stuff like that, right? So, there's a lot that goes into that, but it's very true.
Like one saying, strong body, strong mind. That's like one thing I really believe in. Yeah,
strong body, strong mind. Yeah. But you could also see, I also saw that like once I was able, because he was so kind of hunched over as well, because he had that mental kind of funk, you could tell.
Yeah.
But I mean, I was like, let's open your chest up, let's open your posture up, let's strengthen your muscles. And he would come in, he would feel better, he would look better. His facial expressions wouldn't be as like afraid or kind of like, stressed. He was more relaxed.
Yeah.
And there was one time that I heard him, and the entire time I heard him laugh, and I was like, whoa, this is cool. I made a breakthrough,
No,
he was one of those guys that was so serious,
It's so amazing to see like these elite athletes with that really good mindset, and then one bad injury happens and they lose it all.
It's nice
to like have doctors like you that are helping them out in the way so they can gain their confidence back and perform at the high level that they're used to be.
Yeah, and people think that like, orthopedics or outpatient orthopedics is just very cookie cutter. It's like you just do these specific exercises. It's like, no, everybody that comes to you is very different.
Yeah.
And you have to approach them in that way, completely different from the next person.
Yeah.
Nice. We're going to move on to our last segment, which is a rapid fire fun questions. Okay. So you can say the first thing that comes to your head.
Okay.
I'll start with the first question, which is one piece of rehab advice you wish everyone took seriously.
Going back to the steps, getting at least 7,000 to 10,000 steps every single day. It doesn't matter how old you are, how young you are. If you're able to do that and you could do that without pain, just get your steps in.
Okay. A sports team you would love working with in the future?
I'm a Houston native. A sports team I would love, honestly, any of them, man. Obviously, Texans, Rockets. Even, I've gotten a little bit more into like seeing Houston rugby.
Okay.
The Sabercats.
Wow.
That'd be a cool team to work with as well. If you've never been to a rugby game, go watch rugby.
Okay.
Right.
They are intense, man.
I bet. Yeah, I see like clips of
I've seen it. It's like
Yeah.
no padding, just like
Oh
full.
my gosh.
visual.
Yeah, they're just going right into the end. These
Yeah.
guys are super strong.
Jacked.
They're massive, but they come with a lot of injuries too.
Yeah,
right.
yeah.
So Houston Sabercats, that's a team that I'd love to work with. Yeah.
And if you weren't a physical therapist, what would you be doing right now?
Man, I don't know. That is such a hard question because like I've like devoted my whole life and all that stuff to this profession, but like I think something that's just completely different, like a pilot or something like that.
Oh,
I know that's like a
wow.
cliche kind of thing that some people will say a pilot, but you get to travel. You get to travel so much.
It is a very interesting career. Yeah.
I actually had a patient who he was a pilot for I think like a chartered airlines or something like that, a private airlines, and he would be like, yeah, whenever we're going from here to Greece, we get to do whatever we want while the people are doing whatever they want in Greece. And it's like, dude, you get to travel the world.
That's crazy.
And he loved
For
that.
free.
Yeah, exactly. Yeah, pretty much. Yeah, for your job.
I was going to say, like, when I was a kid, I used to think the same way where I was like, maybe I should be a pilot because I get to travel so
Yeah,
much.
exactly. Traveling is so underrated. And it's like, I feel like people after the pandemic have realized, we have to do this.
Yeah.
You have to get it done. Like this is one life to live. There's so much to see in the world.
True.
And you never know if
ends.
it can get shut down, if that capability can get shut down. And I know people who just they don't really care for travel or anything like that. I love it. I love traveling.
That's great.
It's just having the time and the accessibility to do that is also important.
Yeah.
Yeah.
And then last one is, what sport have you seen that has the most amount of injuries?
What sport has the most amount of injuries? I don't really know what the incidences are with rugby, but I would suspect
Rugby.
that rugby would be pretty high, especially going to one of the games there and just like seeing the impact and seeing these guys kind of hobble back. You're like, dang, dude, these are some strong hits. But besides that, I'd have to look into the research, honestly, to see exactly which one. But American football.
Yeah,
Football.
100%.
American football with certain like athletes, like female athletes, soccer and basketball, I've seen quite a bit with like ACLs and stuff like that. But
I have torn mine in the past.
You've torn yours? Oh, really? Did you have to have surgery?
No, it was a partial tear. So the doctor said you would have to sit out for a year, not do any sports. So I gained a lot of weight. And I was, like you said, I was very nervous to go back at it. And I still feel it every now and then. But I remember when we were about to do boxing together, I was very hesitant. I was like, I don't know if I'm going to like mess it up again.
Twist it
or something.
Sprain it again.
But surprisingly, after doing boxing, my knee got stronger than it was before. So
there you go. Movement is medicine.
Yeah, 100%.
That's right. Did you see a PT?
I did not.
Oh, okay, gotcha.
But I should have.
If you did, you would have recovered way faster.
Yeah, because it took me 3.5 years.
If I would have known you back then,
now I know
Dr.
who to
Jacobs.
Exactly right.
I'm coming through. And again, I think we're done with this podcast.
Yeah.
Dr. Jacobs, thank you so much. I feel like your story, your expertise, and your passion for helping others move forward is very inspiring. And to anyone listening, I want to give you all advice is like, if you ever battle pain, burnouts, or self-doubt, know that healing is a process. Be patient with yourself and just,
And make sure to follow Dr. Marvin Jacob on TikTok and Instagram. I'll include his tags up there as well in the video, as well as like his email address. If you have any questions that we didn't get to ask him, feel free to email him, and I'm pretty sure he will get to it as soon as he gets the chance. And please share this video so we can keep having more viewers and bring
Keep
more
growing,
professional guests.
because we want to keep
growing.
bringing more guests for you guys.
And we'll see you at the next podcast. Thank you so much for watching.